Good morning. This is Michael Jordan with MagnaCare, President of our Labor and Strategic Accounts Division, coming to you today from our Tinton Falls office. Today's topic for our broker bulletin is on wellness and prevention in the workplace. America is currently facing a triple threat. Many of us are aware of this. What are the triple threat options? Poor health habits. Many of us are eating different foods that are processed that decades ago we didn't. There's also a prevalence of chronic disease. 30 million Americans today have diabetes, which represents 10% of our population. We have 86 million members or people in this country that are at risk, which could increase the country to nearly a third who have diabetes. But diabetes is not the only chronic condition. We have hypertension, we have cardiac conditions, we have COPD. So clearly we are living longer lives, but we have a lot of other medical conditions that we're dealing with. Lastly, we have increasing healthcare costs. Over the past couple decades, we've seen healthcare costs more than double and triple, depending on the time period that you're evaluating. But the good news is that we're talking about it. In prior decades, we really weren't focused on wellness programs in the workplace and prevention. Today, there are many advantages to offering a wellness program as an employer. One, you can reduce healthcare costs by keeping the healthy and focusing in on those who have medical conditions to get them healthy. There's also improved overall productivity. If people are healthier in the workplace, they're sharper, they're keener, they're working harder. There's also reduced absenteeism. So if you're not getting sick, you're actually going to work every day. In addition, we have decreased employee turnover. So if you offer a wellness or a prevention program, it's an incentive for employees to want to stay with that employer. In addition, if you're trying to attract new employees, wellness and prevention programs are a great tool to bringing in individuals that are potentially more qualified than someone else that you're interviewing because you're giving them an additional benefit. And this goes way beyond gym discounts, which is where we were sitting 10 years ago. This is really focusing on individuals and encouraging them to have healthier eating habits. So many employers have put information around the walls of the cafeteria, of the walls of the office building, talking about things you can do differently as an individual. Don't take an elevator, walk down the stairs. Take a walk outside. We discourage smoking. We want you to eat healthier. And a lot of this we can also tie to incentive programs. So here at MagnaCare, we have an incentive program called Life Points. If you go and get an annual physical, a flu shot, or if you're a female and you get a mammography, we're going to pay you an incentive to do that. So as an employer, these are the things that you should be talking about with your employees and your broker going forward.